Hi, I'm Michelle with CBH Ministry and Cancer Foundation. Many of you already know who we are and you know our passion to help those battling cancer. You've seen us distribute our gifts of hope to both individuals and cancer centers in the area. You guys follow us on Facebook. You write in and you share your stories of inspiration to share with others. And Doug and I just can't thank you enough for all the support you've given us throughout our very first year. Thank you. Part of our mission is to educate and let our followers know some of the services that are out there to help them deal with the side effects of a cancer treatment. This week we had the opportunity to interview Dr. Charles Stevens from Mobile Therapy Services on Main Street in Dallas. One area of particular interest to us is how to help cancer patients with some of the effects of a cancer treatment. We are going to be discussing the topic of lymphedema. Before we could get into lymphedema and exactly what it is, we need to understand and define exactly what a lymph node does. So lymph nodes are part of our lymphatic system. We have over 600 in our bodies, and they are located in groups or chains, and they can be found in the neck, in the underarm, which is also known as the axilla, the abdominal area, which is known as the aortic area, and in the groin, which we call inguinal. We also have lymph nodes located in the back of our knees as well. Lymph nodes are shaped like kidney beans, and their purpose is to serve and act like a filter. They filter out all the fluid that comes back to our heart and our lungs through the circulatory system, and they basically pull out things that just don't belong. So what doesn't belong would be broken cells, waste products and bacteria, and even cancer cells. Many of you have heard the term sentinel lymph node a lot when it comes to testing for cancer. So the sentinel lymph node are the first 1, 2, or 3 that drain from a particular group or chain that we talked about earlier. When part of the lymphatic system is permanently damaged during a surgical removal from either sampling them or from a biopsy or even from certain cancer treatments like radiation, your system's ability to drain the waste products we spoke about earlier can be compromised. Over time, the excess fluid backs up and even causes swelling. The longer this fluid sits in the tissues, the more difficult it is to get rid of. We are going to be talking to Dr. Charles about some of the symptoms patients see that are caused by lymphedema. Hi everyone, we're back. You just saw part 1 of our video discussing lymph nodes and what they do, and we are sitting here with Dr. Charles Stevens of Mobile Therapy Services. Dr. Stevens is going to discuss more about the initial video that you just saw discussing lymph nodes, but he's going to be talking in depth about lymphedema and the ways that his clinic can help patients suffering from that disease. So let's introduce Dr. Charles Stevens.
Great. Happy to be here with you, Michelle,
Yeah.
and at our clinic right here on Main Street in Dallas. We're the only provider out in Dallas right now treating lymphedema and the only provider to treat it via house call.
Okay.
So unlike home health, our patients don't have to be homebound, and we're able to make house calls for outpatient therapy. So it's a nice service for some of those patients who cannot come to a clinic.
Why don't you tell us how Mobile Therapy Services started? Tell us how you got here to be here in Dallas.
Well, company's about 5 years old, so it's been a blessing. We've had so many people to help, and we're grateful for our patients and our referral sources. So I noticed there was a niche about 5 years ago where patients in the home, after home health services under Medicare Part A, oftentimes couldn't come to a clinic, and we were able to treat these people under Medicare Part B for outpatient therapy. So we did that extensively and exclusively only for about 4 years, and within the last year we added a brick and mortar clinic here in Dallas, and I went to physical therapy school in Dallas, and I wanted to give back to the community, and really we're on a mission to help the Back Mountain area and Luzerne and Lackawanna counties really help their patients with lymphedema, keep our older population in their home, and prevent people from going for unnecessary injections, medications, and surgery.
That's fantastic. So lymphedema. And we know our oncology population, that is a huge topic of discussion for anyone who had what we were talking about just before with the sentinel lymph node biopsy. A lot of patients suffer from lymphedema just because of the treatment. So tell us more, like, what are the physical symptoms of lymphedema? What do people need to look out for?
Initially, it could just be a heaviness in an arm or a leg. As the disease progresses, the swelling would increase. Initially, it might be alleviated with elevation. As the disease progresses, elevation might not change it. There will be skin trophic changes where the skin will get thicker due to fibroblast activity within the soft tissues. The gold standard to treat it, really the only way the medical community can really effectively treat it, is complete decongestive therapy, which is a physical and occupational therapy, hands-on technique that involves a special form of massage called manual lymphatic drainage to stimulate lymph nodes that are not affected to absorb some of this fluid. And we can move that fluid to other parts of the body via lymphatic watersheds. So a big part of the treatment is actually moving that fluid. So if it was your right arm that was affected, we could move that fluid to the left arm and to the right hip, assuming that those were not compromised areas, to move the fluid so they can be reabsorbed. And then we teach a patient about skin care, exercises, because when the muscles exercise, they squeeze against the veins to pump out some more fluid.
So not to interrupt you, but we know lymphedema, it's not really curable, right? But it's very treatable.
It's not curable, but it is treatable.
Now, are patients able to take advantages of these services while undergoing treatment for cancer? Or do they have to wait until signs and symptoms develop? And I'm going to follow that up with, I guess in other words, is there something that they could do proactively to have a better outcome for their cancer therapy?
I think just proactively overall, just look at their overall general physical fitness, their strength, their grip strength, their balance, their walking. While someone's going through any sort of cancer treatments, we don't want them to fall and have a new issue or a fracture that didn't have to happen. And there's so much research on grip strength and lower body strength that can predict falling hospitalization rates. In terms of lymphedema, they can be screened by their oncologist, or even us. We would need a referral to treat a Medicare beneficiary. While they're going through treatment, we'd have to get clearance from oncology in terms of are they safe and appropriate to treat at that time. So we work closely with all the physicians.
So you work closely with the oncologists in the area?
Yep.
Okay. Can you tell the people that are watching right now what other kind of services you have to help those patients suffering from this condition, as well as, say, the general oncology population?
So aside from lymphedema, which could be treated here at our clinic or via house call within Luzerne and Lackawanna County, we treat any gait, mobility, balance related issues. So if people watching have had a fall within the last year, the statistic is of those older adults who fall once, 2 out of 3 of them fall again the same year. So that may necessitate a physical therapy or occupational therapy evaluation, looking at home safety, balance, walking, pain, medication issues, blood pressure issues, any sort of orthopedic pain from head to toe, whether it's TMJ issues of the jaw, which we can effectively treat, spinal conditions, rotator cuff, shoulder pain, back pain, sciatica, neck pain, knee, hip, foot, ankle, you name it, really.
Wow,
From head to toe.
I think he's got this guy and everything else covered.
So,
well, you have this apparatus here that you are very proud of, and when I came in the other day, Dr. Stevens was very proud to show this to me. So do you want to explain to the people watching what this is?
So this is very cool. This is a portable diagnostic musculoskeletal ultrasound.
Okay.
There's no other private practice in the area that's utilizing this technology. It allows us to capture images in real time of the muscles, bones, and the joints. So whether that's the rotator cuff, the carpal tunnel, you can see the median nerve going through the carpal tunnel. Knee, you can see the menisci of the knee, or the hip, the bursa of the hip. So many common orthopedic issues. This allows us to capture images. I myself have special training from a PT who's RMSK certified, which is about the highest level of proficiency you can get with diagnostic musculoskeletal ultrasound. So It does made up right with an iPad or an iPhone. We can capture pictures, videos, and take it on house calls. So it helps us better manage the patients and come up with treatment plans to help their conditions.
So you just mentioned, and I guess part of your business here is mobile therapy services. So you do make house calls.
We do make house calls, yep.
To what area? Like,
We cover Luzerne and Lackawanna County,
okay,
Lackawanna County, really from Clark Summit all the way out to Carbondale, and everything from Clark Summit, Pittston, Moosic, Scranton, all the way down to the back mountain, Bear Creek, Wilkes-Barre, Kingston. So much of the valley we serve.
I know you had mentioned before about insurance companies and you started talking about referrals. So for the patients out there who are really unsure, you know, do they take my insurance? Do I need a referral? What do you have to say about that?
So we're blessed in Pennsylvania. We have the opportunity to practice with direct access. So as a physical therapist, I have a direct access license, which I can treat for up to 30 days without a referral. All Medicare beneficiaries would need a referral from oncology or primary care or any specialist or internal medicine. And we are a Medicare approved provider with all secondary insurances, all the Highmark, Blue Cross Blue Shield plans, Aetna and Humana.
Wow, okay, so you really work with a variety of covers there. Okay, well, you know, is there anything else that you want to add to the interview that maybe I didn't talk about?
Just urging everybody, you know, the number one biggest mistake people can make in terms of pain, balance, or walking is to ignore it. So, you know, therapy can help, and give us a call at 570-282-9382 and ask to speak to Daniel. We can do a discovery session with anybody just to see are they appropriate for therapy or could we help their condition, to come down for a consultation with myself. And I want to thank Michelle for the opportunity to talk to you guys.
Well, Dr. Stevens just mentioned Daniel, and speaking of Daniel, I want to say hi to you. Hi, Daniel. I really enjoyed meeting you the other day. Daniel, the reason I met Daniel is Dr. Stevens is now carrying what you see here. This is our newest fundraiser for CBH Ministry. We are offering a one-day shopping pass, and we're working with Boscov's, who is actually hosting the fundraiser for the area. And Dr. Stevens is kind enough to put these out in his office for his patients to take advantage of. So we thank you for that. It's 25% off one day, and that's in October, so it's a great way to get a head start on your Christmas shopping. And it's also a great way to come in and meet Daniel, and it's an even better way to come in. You get to see the services that Dr. Stevens has here. We will post some pictures of the gymnasium that he has. Now, are you on Facebook too? Before I forget, I want to see if you're on Facebook.
We do have a company Facebook. It's if you search mobile therapy services, you would find us. So we are on Facebook, and we do have a website, mobiletherapyservicesnepa.com.
Okay, so we will post those with this video. I'll have them run across the screen for you. So this way the patients know you gave the phone number. Dr. Steve Mobile Therapy Services is on Facebook. They have their website. Is there anything else that you want to add in? I think this was a great way for the community to know about this hidden gem. We're right here on Main Street in Dallas, and if you come in here, Dr. Stevens just has so many ways that he can help not only our oncology population, but like he said, he offers physical therapy services, a lot of rehab services. So take advantage, stop in, say hi to Dr. Charles, and make sure you say hi to Daniel.
And with one other thing I wanted to mention too, just prompted me that one thing people don't know, we had many patients, even some of our younger patients, they thought they had to wait until after an injury or after a hospitalization before they get therapy. And that's not so much the case. We can do preventative care, and oftentimes preventative care is much better than dealing with things after the fact. So you don't have to wait until after a rotator cuff repair or after you have stage 3 lymphedema before getting treatment. I absolutely want to see people when they are at the earlier stages, when it's easier to treat, it's more cost effective to treat it, and the patient has a better outcome. So
how soon is it? That's great that you brought that up, because let's say somebody was in an early stage of having lymphedema and they waited to get treatment. What is the outcome like if somebody came to you in the very early stages versus weeks or even months later? How long is that treatment different wise?
Once somebody's very progressed with the lymphedema, where there's, the skin changes and it's at the worst it could be, once the lymphatics is permanently damaged, it's going to be a lifelong management of the condition.
It's a commitment.
It's a commitment to the care. So if we can identify those people who are at risk for developing those issues, or people just complaining of heaviness in their limbs, we can work closely with the physicians and try to get them on treatment plans to help them before they lose more function or at risk for developing cellulitis and other
Right.
issues along those lines.
So we know things could turn. In other words, catch it early. If you take care of your body in the early stages when you know something might be wrong, or even stop it and say, hey, Dr. Stevens, do you think you can help me with this? And he'll tell you, yes, I can, or you know what, not at this time. You might just want to
monitor it, or
monitor your signs and
6 months.
symptoms. Yeah. So it was so nice to have this interview, and we certainly do appreciate it. And from myself, and Doug is working the camera, as you guys know, he's always behind the scenes. So it was really a pleasure to meet you today, and thank you so much for letting everyone know about what you do.
Thanks for the interview.
All right.